I'm going to go through the basics of an ICHRA for those of you who haven't, and we'll talk about the pros and cons, how they came about, where we are now, and what we're seeing in the place. Obviously, our agenda. I guess I should have clicked to that slide first. So, compliance, key ACA compliance rules, and key components that you guys need to remember, and then we will have the 10 minutes at the end. If you have a question during, because I know I have a tendency to talk too much, raise your hand because I do have the 15 minutes lined out, but I really want this to be informative. So raise your hand. We will make this work. Okay. Ew. Gonna skip that one. Sorry. I'm gonna go back to explain that. I don't like pictures of myself, but I ended up in the ICHRA industry because most of you know I was the Indian Medicare rep for Northern Idaho and Eastern Washington until May of last year. They ended up moving me to the individual market for all of Washington. And then guess what is very popular in Washington? ICHRAs. So I got a crash course in how they work and what was drawing employers to them, what was drawing members to them, working with third-party administrators, finding all of the ins and outs with the laws and the interpretations or loopholes that were being used. So with that, let's kind of go with the history of ICHRAs. We all know what HRAs were and where they came in. So in 2013, they got restricted hard because of the ACA. That was put in place, meaning that no employer was allowed to offer an individual an HRA. That kind of limited what options they had. So in 2017, with the 21st Century Cures Act, they brought in a QSER Act, which is similar to an ICHRA, but it has a limited amount that can be contributed per employee. So but it's only offered to employers that had 50 employees or less. So you can still offer a QSER now. ICHRAs are more popular. We'll get into why. So in 2019, they created the ICHRA, and that was the final rule, saying that there were going to be no size limit, that it could be applied towards premium and/or medical expenses, but offering employers more of that flexibility in benefits. In 2020, they went live. Kind of had a little bit of a hard hiccup going out there because a lot of people didn't understand how it would work. Do I have to do an ICHRA? Do I have to do a traditional? Is it going to be beneficial? What are all the little tiny quirks that we have to deal with? But what we've seen since 2024 is that they have expanded massively, exponentially. And there's a good reason for it. So how an ICHRA works. We know it's the tax benefit that offers employers that tax savings that they have, but it also gives their employees the option to pick their own plan. So instead of a traditional plan where you have bronze, you have silver, you have a gold plan, now they can say, you know what, I want to choose Blue Cross, or I want to choose Kaiser, or they're not stuck to the plan that's being offered by the employer. Now, it does have to be an ACA compliant plan, meaning it's not eligible for your MediShares or the share programs that are out there. It does have to meet ACA requirements. And they can purchase through the marketplace or directly through the carrier. Step 2 in the ICHRA is that the employer is going to fund it. So obviously that money is then going to go to the employee to pay the premiums. And then option 3. Everyone wins because the employer has a set fixed amount that they are giving to each employee. They know exactly what's going out. They're not going to have to worry about increasing the costs when it comes to traditional plans. And the employee can choose a plan that is fit for their specific needs.
Yeah.
Yes.
Right. So if they're pulling their choice from the marketplace, do they qualify for the tax credit?
Possibly. We're going to get into that. We are going to get into that. Yeah. So if they do qualify for a tax credit and they qualify for an ICHRA, there is a loophole. But we will get into that as we get further in. Yes.
So if somebody opts not to get insurance, they don't qualify for any ICHRA funds.
Correct.
And does it a limit of how many employees have to participate, or?
We'll go more into that too. So how it works is the employer is going to set their allowance based on classes. So how many of you guys have all done group plans and set up classes in your group plans? Okay, so you understand the basics of a class and how much is being contributed towards each level. That is what the set allowance are. The one key difference between an ICHRA and a traditional group is that an ICHRA offers 11 different classes, and we'll get into more of those classes later. So it becomes a little bit more flexible, but yet it still keeps a consistency for the employer. So they can set aside full-time, part-time, seasonal, etc. Then the employee is going to go and enroll in a plan of their choice, whether they choose to go onto the marketplace or if they choose to go directly with a carrier of their choosing. Once they have picked a plan that fits their needs, they're then going to submit that information directly to the employer, where the employer is then going to refund them. Now, this is key because there are two different ways that this can happen. They can have it ran through the business themselves, where the business is going to manage all of the documentation, or they can set up a third-party administrator. I recommend the latter.
Right.
Only because if your HR department is a tiny little one person, like I was, get a third-party administrator. The HR department is going to have to validate that it's an IRS medical qualified expense in order to release the funds to the employee. The way that this is designed here is that the employee pays the premiums directly to the carrier, and then they get a check back from the employer. A third-party administrator basically takes this portion and says, okay, we will pay your premiums and deduct the difference out of your paycheck and submit it all to the carrier. And they handle what is qualified as a medical expense. It does not put any heartache on the employee or the employer. Okay? And then obviously step 4 is where the employer reimburses. Your third-party administrator is going to take those funds and that's deposited into a set account for that member. Can be very complex, but the key benefits: cost predictability. Obviously, they have a fixed monthly budget. So if they have full-time employees, say 5 full-time employees, and they're going to say, I want to pay $500 a month for each full-time employee, they know exactly how much they're going to be paying out each month in their healthcare costs. With your traditional group, they have to pay that 50% of the lowest, come on in, that's okay, the lowest bronze plan available, which can fluctuate year to year. I mean, you see those rates can jump from 10% to 25%, depending upon the usage of that traditional plan. Whereas ICHRA's, it's a fixed cost. It's not going to rate based on how much that plan's being used. There are no size limits. So you can have 1 employee to 50 employees to 600 employees and still offer an ICHRA. The key is that they do have to be ACA compatible plans. So those shared programs are not actually eligible for ICHRA reimbursements. But as long as they are choosing an ACA compatible plan, so anything that meets minimal essential requirements, they can actually use the ICHRA, and it saves any of those large employers the ESRP tax, that employer shared responsibility payments. So they get taxed if they have a plan that is not qualified as ACA, or if it is not considered affordable, they get a penalty. But an ICHRA will save them from that. Employee choice. So workers can select the plans that fit with their doctors, their medications, their family needs. Difference if you have a 25-year-old single employee versus a 41-year-old family of 5. As we know, network negotiation is one of the biggest pain points for all carriers and our members, because our rates usually are affected by what those negotiations come out as. So this gives them the options to choose and shop based on what fits their needs. It is a tax advantage, so the reimbursements are tax-free to the members or to the employees, and it's a tax deduction for the employers. So it's still a win-win for both sides. And then obviously you have the flexible classes that I mentioned. We have 11. Going into your differences.
That you recommend TPA.
Mhm.
Do you have a recommendation for good TPA companies in Washington and Idaho?
I'm going to tell you to shop. The reason I'm going to say that is that every TPA is different. They have different costs as far as what they're doing, how involved you are, shopping platforms, shop. Because every TPA is going to have something different that works better for each employer.
Yeah. Are there any that specifically are great at this?
There are 37 of them that I work with that are really good at this. So, I'm like, that I'm working with currently that are really good at ICHRAs. They all understand it, but each of them have a different little niche. That's why I say shop. You don't have to use the same TPA for every employer. You can use 2, 3 different TPAs. So if you have a company that is headquartered here in Coeur d'Alene, but they have 50 employees outside of the United States or outside of Idaho, thank you, not the United States, you may want to look at a national company like, well, we have Thatch, you have Mysoro, you have, I can't think of the rest of them off the top of my head that work that far out that are in those states. But ultimately, you want to check to make sure that they're licensed in the state that the employees are sitting in. They understand the products, their platform is easy to sign up for, but all of the documentation and requirements, they all know inside and out. Doesn't matter which company it is. So I'm not biased when it comes to one. I will tell you that right now. They're all very good at what they do, and they all have just different niches. So you really want to shop at what plans are going to be best. Okay. Any other questions? Yeah.
Do employers tend to increase reimbursement as time goes on? I expect they should.
We've seen some, yes. We have seen some, and we've also seen some reevaluate each year based on local areas. So one of the key things that I'm going to point out when we get to the employee classes is that the employee classes on an ICHRA are broken down so far that pretty much it is so flexible for an employee or employer to determine what they want to do. So if you have an employee here that lives in Seattle, you're obviously going to want to give them a little bit more than living here because cost of living there is going to be more. So that's kind of where they usually reevaluate each year and increase based on that. But they can control how much they increase versus a traditional group. So obviously, employer size, ICHRA is any size. You can have it from 1 employee to 600 employees or 1,000. QSERA is only designed for 50 employees or less. And they do have the max limits. Group plans, depending on the carrier, you have a minimum of 2, some are a minimum of 3, and you have to have at least 50 to 75% enrollment. Your annual caps, this is the amount that the employer can offer. So ICHRAs, there is none. They can offer to cover $2,000 a month per employee if they want to, or as low as $25 a month if they really want to. I don't usually recommend that one for health insurance. QSERAs have a limit. So they are only allowed to offer $6,350 per year per employee or $12,800 for the family per year. And that does fluctuate just like HSAs. The limits do fluctuate, but QSERAs are limited to what they can contribute. Obviously, a group plan, there's no cap on that. It's market driven. It's dependent upon whether the rates are going up or they're going down. You're contributing what that traditional group plan is. So your employee classes, like I explained, we do have 11, which we'll get into. QSERAs do not have employee classes. So it's the same across the board. And group plans we know are limited. All 3 of them are considered ACA compliant. But the key is that your ICHRAs and your QSERA have full choice. So your members have access to whatever carrier they want. If you have a traditional plan and you offer an ICHRA alongside of it, which is possible, if your traditional plan, let's say, is Origins, just because I'm here, and they offer an ICHRA, the ICHRA people can take Blue Cross or they can take Pacific Source, and it's okay. That's the only way it works because you can't offer 2 group plans at the same time. But it would have to be an individual plan. So either directly through the carrier or through the marketplace, not a group plan. Obviously, we have the tax-free reimbursement on both ICHRA and QSERAs, whereas your traditional groups, you have the premiums are pre-tax, giving that employer that tax benefit. And the one thing is, on ICHRAs and QSERAs, if the employee does not use or does not choose to accept, the employer gets to keep those funds. So it's not a wasted money where they're having to absorb the cost of covering an employee who is not using or taking advantage of their benefits. Gives them kind of a little bit more of a cushion. Yes, I promise I'm sending out the slide deck after.
So-
it is kind of hard to see. Yeah.
So you said something about say they can go on the group plan or do an ACA approved plan. So who's going to do the application then? The employer or the
We do.
employee?
So technically the employee, when we get into that setup, which we can get into a little bit further into this, your traditional group plan is going to be set up for a certain class. Okay. Your ICHRAs are going to be offered to a separate class. That separate class is going to be managed by your third-party administrator, which is what I highly recommend. Their platform will take them through shopping, which plans are available, what will fit, and completing the application. Similar to them doing an application through the exchange.
Okay.
Are you gonna talk later about, like, say I have a small group of 30 people and 15 go on the ICHRA? Now those other 15 left on my plan, are those rates gonna change drastically because now those people aren't on my plan and isn't it driven by usage?
So it is driven by usage, yes, and you would see a traditional change in those rates. What we usually recommend, and that's part of calculating out whether or not it's a fit for that company, is if you're looking at you have 15 employees and all 30 employees and all 30 of them are here in Idaho and they're all using the plan, stay with the group plan. The only time an ICHRA really benefits at that point is if you have somebody that I live in Spokane, but I work in Idaho.
That makes sense.
Yeah. So there's some key differentiators that we're going to end up going through. Implementation and compliance. So one key thing is that all employees have to have an ACA compliant health plan. So if they're doing a straight ICHRA without a traditional plan, they have to be enrolled. If they're not enrolled, they are declining the coverage, which means the employer is saving that money. Okay. Obviously, minimum value for anybody that's under the ALEs of 50 employees or more, the ICHRA must be considered affordable. So we all know that 9% rule. If it's not affordable, they can actually go onto the exchange to receive their tax credit. Same rule applies with ICHRAs. If they're getting a $500 ICHRA balance, but they look at the tax credit and the tax credit actually saves them more because they calculate under that 9%, they can decline the ICHRA and receive their tax credit. But they do have to decline their ICHRA. And this one can get tricky. So if they have over 50 employees and it is not considered cost affordable, they get that ESRP. They will get hit with that. Obviously, notice and requirements when it comes to ICHRAs, all employees have to receive their notification 90 days prior to their eligibility date. That gives them 90 days to shop and look at the plans. A little different than the 60-day SEPs that most of us are used to. ICHRAs give you a 90-day SEP. Am I walking off screen?
Oh, I'm just making sure. We're still good.
Okay. All right. They do have the opt-out option. So if they choose not to take their ICHRA, they can opt out. The employer is not going to be penalized for it. The employee at that point has their own insurance, whether it is they're on a spouse's insurance, because it makes more sense, or they want to stay on their Medishare or religious-based insurance, they can opt out of an ICHRA. That saves the employer funds. The tax credits, like I mentioned before, this only qualifies if they don't hit that minimum affordability 9.12%. And substantiation requirements, because I had to have a college word in there and sound intelligent about this. They have to provide proof of coverage, and it has to be considered proof of credible coverage. So every carrier, we all give you that proof of credible coverage if it's asked for. This has to be submitted. This has to be documented. If the company is managing it themselves, they have to keep a record of it on file, especially for the IRS. If they are using a TPA, the TPA will obtain all of this and maintain all of this for the employer. So I highly recommend a TPA.
Quick question.
Yeah.
Maybe it's one for Jackie.
I would
Does
assume
the access plan qualify for the ACA? Because not.
that's right.
No, it's not ACA compatible.
No.
But it meets all the restrictions, doesn't it?
No.
So this is.
Yeah.
So if an employee opts out and they say they have coverage and then 3 months from now they don't have it, who's responsible for that? And
The
they don't
employee.
tell them.
The employee. At that point, it is they are given the opportunity and they are choosing to opt out. They are declining the coverage. It is not on the employer. It is on the employee. Yes.
I know the answer to this, but I thought it might be, I think what other people are thinking. Say an employer implements an ICHRA, starts offering an ICHRA in June. Let's say employees had no prior coverage.
How are they gonna show an SCP to get onto coverage through ICHRA or for the counter?
So that is the initial offer letter. That 90-day requirement that they have to send out is gonna, the initial offer is saying, well, we are changing from a traditional option to an ICHRA option. You have 90 days to choose your option. That gives them that qualified SCP.
That is.
Yeah. And key thing on that, because underwriting will check, doesn't matter what carrier, it has to say initial offer. If that does not say initial offer letter, that will pend your application because the requirements state that it has to show it's new. Now, if it's a renewal offer letter, that is done during your open enrollment, which ICHRA open enrollment is the same time as ACA open enrollment. It's not managed on a group like others. Do you have a question? No.
So new employees, it's if they join, then it's an initial coverage.
Yes. So this is the fun one for me, the employee classes, because you have several different options. I mean, full-time, part-time, seasonal employees in a waiting period are eligible for a class. Employees that are 25 and below, salaried, hourly, employees in certain locations is key. You can even offer to temporary employees, former employees, or employees covered by a collective bargaining agreement. Okay. The key with this is that if you have 5 employees in full time, 3 part-time employees, 2 employees under 25, and 4 salaried employees, you can set up 500 for full-time, 400 for part-time, 300 for your under 25, and let's say 1,000 for your salary. If they qualify for that class, they all have to get that same amount. So even though a full-time and a salaried would technically be considered the same, they're classed full-time, they only get the 500. If they're classed as salary, they get the 1,000. You cannot change or you cannot combine
I
classes.
think that's opening up
Is this
discrimination.
employees under 25? So I mean 25 people or age 25?
Age 25.
So why would that be?
They're cheaper.
Because they're cheaper. Because they're cheaper, and it's in most cases, any employee that's under 25 is going to decline their ICHRA because they're on their parents' insurance.
Yeah.
So it's a subset class that was put in there just to try and coax under 25s to come onto group plans and to help even out the market.
So as former employee, if somebody leaves and comes back, you can put them in the class forever.
You could also, like, I love using Mom and I as an example. When she fired me, she could have put me into a former employee class and said she's a former employee and still offered. So, and one thing I will say is that your former employees, this is really, really good for your Medicare people because they can still accept the ICHRA and have their Medicare paid for. Any other questions? Any thoughts? Any crazy?
If you have full-time employee class, but then you also have salaried and hourly employees, how do you classify those? Because typically, if they're full-time, they're either going to be salaried or hourly. So
your full-time is going to be based specifically on hourly. If they are working 40 hours a week, your salaried is going to be based on your set salary for the year. And it really is good for seasonal employees too. Like if I'm bringing people in for open enrollment because Lord knows we need extra help on those times, but they're only going to be here, giving them an incentive to stay during that crazy time. Having that seasonal really works with employers to kind of determine what is going to be best suited for them.
What is usually the waiting period then?
That's up to the employer.
That's up.
Because you do this with so many people, from your perspective, how does this work? Like, say you have a group of 50 and they have an agent. How does the agent deal with all this? I mean, what if they're not certified to sell some of these things? It's like, do they go to another agent? I mean, how does that affect those people?
So that's when I tell you to get a TPA. So your third-party administrator is basically designed to help you as the agent of record set up exactly what the employer wants. Have those meaningful conversations with the employer to determine what is really going to give the benefits to all of the employees. And they set up all of the logistics. You get to keep your name on it. So you're still the agent of record. You're still going to be that face to that employer. You just have an administrator on the back end that does all the heavy lifting. So I always recommend the TPA. I mean, until you really understand and dig deep into going how do I create this? Where's the 125 documents that need to be completed? What storage or what information needs to be submitted to the IRS? Until that's your full-time job, get a TPA. Definitely. Any other? Oh, okay. All right. I'll keep going, I think. Maybe. There we go. So, who should consider an ICHRA and who should not? This one is key because there are some big factors that we all see on a day-to-day basis. So, great fit for employers that are seeking budget-friendly coverage, right? We know that. Small businesses without a group plan. So if it's 1 to 3 employers, they just want to offer something, but a group plan doesn't make sense, and ICHRA might make sense. Companies with geographically dispersed teams, headquarters in Coeur d'Alene, Idaho, but employees in Texas or Seattle or New York. Employers wanting the predictable costs. What's the biggest complaint we all hear when it comes to group renewals? Why did it go up so high? Well, this would give them a little bit more of a combined side. Sorry. My brain is just not going there. And then obviously companies replacing or augmenting a different type of group coverage. If they're frustrated with the group coverage that they have and they're trying to find something, this might be an option that would be suited to. Then obviously offering any type of coverage to time, seasonal, and or temporary employees. So if you have people that are coming in, you want to give them a benefit, you want to keep them to stay, to prove themselves, to maybe move to a full-time position, this is kind of one of those little options that gives them that. What I do really want to stress is what you want to carefully consider. So if the employees value the fact that the employer picks the plan, takes that stress off of them, and says, nope, this is what my employer has, this is what I want, then an ICHRA may not be beneficial in that situation. Also, looking at the ACA options in the region. That one hits more to home in my territory now than it does here, because San Juan Islands, we had to pull out of San Juan. There are 3 carriers that are in San Juan Island. So an ICHRA might not be beneficial in that area. But here we have, 5, 6? I haven't been keeping up on the exchange. I've been slacking on my job. Sorry. Shopping in the individual market may become difficult and overwhelm your employees. So that might be a concern that the employer needs to be aware of. Is if they are not technologically savvy, or they don't trust who they're talking to, if they're talking to a customer service through the TPA, or if they feel like they're just a number, this might make it a little too overwhelming, and you'll hear complaints from your employer. So having these conversations, being as open and upfront and honest, being communicative throughout the process is key to implementing most of your ICHRAs. Obviously, HR lacking bandwidth, like I said, if they are a 3-person employer group, you may not want to use a TPA, but if they are not on top of things as much as they are, having that option of having a TPA will make things a lot less stressful for them. Then network availability. I mean, Washington, we just had that major overchange in our network, which is the biggest issue. Why I'm surprised that they skyrocketed in Washington. Our group plans in Washington are a PPO. Our individual plans are an EPO. So you have an employer that's going from a group plan to an ICHRA. You have a lot of members who are like, wait a minute, I can see this doctor. Why can't I see them now? So network availability is, make sure you are aware of that. Yeah.
Another advantage would be if somebody's on a group or a ICHRA plan, say they've met their $2,600 month, and then they leave the employer, they don't have to meet it when they hop on an individual plan through the exchange. They can just continue in their already met their move because they're on the same plan.
Yeah, that is a key benefit. That should be on that side. But I ran out of room on that side, so I apologize. The other thing is going to be disengaged employees. So you're going to have those employees. I know I saw them on a day-in-a-day basis where it come in, okay, it's my time. Tell me where I need to sign. I don't care. I don't want it out. Yeah. You know, that is going to be, if 90% of their employees are disengaged, they don't really care, then this is not going to be an option for them. Yeah.
So you were talking about how employers consider a waiting period if it's for seasonal workers. So does that mean that they can enroll and have it start not the first of the month or just whenever, or is it still gonna be the first of the month?
It will always be the first of the month.
Okay.
Yeah. The only time you can get a mid-month on any plan is if you're coming off of a large group plan into an ACA. Yeah. And that actually, let me clarify, because that's based on the carrier. I know that we will do that, but it is only if you're coming from a blue plan to, and we have to have proof that it ended in the mid-month. But 90% of your plans now, even small groups, they end at the end of the month. You very rarely see the mid-month terminations.
So another good thing too is that if they leave that seasonal position, they still have that coverage without that reimbursement from the employer.
Yes.
Not gonna have to always start all over and reapply to something else.
Yeah, they can keep the plan that they're on. They just lose that health reimbursement. So, and your TPAs, what I've dealt with a lot of them is when we get okay, this person has left. The biggest thing is we have to hear it from the member. So an ICHRA is an individual contract between the member and the carrier,
Not the employer.
not the employer. So that's probably should be on this disadvantage side, but at the same time, it's not a disadvantage because if they hit their maximum out of pocket, they can still keep that plan and keep moving and they don't have to restart. But it is basically an individual financial contract that has to be handled the same way we do ACA plans in a group setting. So you have the benefits of enrolling like in a group, but it has to be managed by that individual employee. So they're a little bit more hands-on. Yeah. You raise your hand.
Oh, just scratch again.
Me. Don't do that.
Dave, just ask a question, please.
A seasonal employee could potentially move into former employee and then keep reimbursing them for part of their insurance as an incentive for them to come back.
Yes.
I mean, there's no guarantee that they could, but
Right. But yes, essentially it's good.
Yeah.
Now you have a question.
I do have a question.
Okay.
This might seem kind of silly because I might still be kind of novice at it, but if a group's outside of there, I mean, I don't know why they would start this alternative outside their open enrollment. Would it be for just the one employee who became legally eligible? Because with that initial offer letter, you said they gain an SEP to the individual marker, right?
Mm-hmm.
Well, earlier I think you stated maybe I glazed over it, but the initial offer gains them SEP to that. Do they say at that time if they're outside of the open enrollment for the group, again starting up this new contract, do they get a deny because they don't like their options or they're overwhelmed? Say, I really do like what my employer has here. I waived it during my initial or whatever, but man, I have this opportunity now. Maybe I can join the group. Are they allowed to do that?
No.
I didn't think so.
Yeah. If they decline during the traditional group open enrollment, and they are then later offered an ICHRA, the only option they have at that point is to go on to an individual ICHRA policy. Yes.
What's the average cost to an employer for a TPA?
Between $5 to $12 is what I was looking at on average, but I couldn't tell you if that is per employee or if that is because it varies depending upon the TPA and how involved the TPA is.
so there's like $15 a month per employee that participates, and then there's some that have a base, monthly platform fee as well.
Yeah. Yes.
Employees don't get an enrollment period if they leave employment and they lose their ICHRA.
So if they lose their ICHRA, they keep their plan. They just lose the health reimbursement. If they choose not to keep that plan, then they are out of luck until open enrollment. Yeah, because it's essentially like, okay, I got my plan on the ACA and now I don't like it, so I want to go to a different plan. I can't cancel that to move to a different plan. That's a downside to the ICHRAs.
But if you lose your employment and your benefit, because on the ACA, if your income changes and you no longer qualify for an APTC or you do qualify for more money or CSR, you potentially could get an SEP. The ICHRA does not see it.
So you could potentially, if now you qualify for a tax credit.
Okay.
Because when you are taking the ICHRAs, you cannot take your tax credit.
Okay.
So if they're going in and no, I'm no longer receiving this HRA or ICHRA, I can then apply for the tax credit portion. And if they qualify at that time, there's a possibility they can change plans. But that is dependent upon if they're qualifying for the CSR levels.
Okay.
Because if not,
Yes.
all they're getting is that tax
Yeah.
credit applied to the plan that they're on. So, any other?
Wait, so you can get a CSR and
No.
No,
No.
no.
is there CSR levels? Whoa.
No.
Well, if you lose
There's
your
a-
ICHRA,
So if
We're
you,
talking about
yeah,
changing something like
Oh.
if you lose your ICHRA or if you leave the employer and you decide to now apply for the tax credits
Yeah.
and they qualify for CSR, that's the only time you have the ability to change plans.
Okay.
Yeah, otherwise the tax credit is just being applied to the plan that's on it. Yeah. Okay. Let's see. Implementations. So as we had kind of mentioned before, first you want to be able to design the plan. So decide what the employee classes are, set the monthly allowances for each of those classes, choose when that's going to start and end for the year, when it's going to renew as far as what increases you're going to do on a yearly basis. Then, like I said, select a TPA. Partner with an HRA administrator because they are going to manage the compliance. They're going to manage the paperwork, the 125 documentation, everything that needs to be submitted to the IRS so that both the employer gets their tax benefits and the employee gets their tax benefits. Then it's going to prepare plan documents. So that's what your TPA is going to get created for you. They're going to create that letter. They're going to have everything set up for enrollment. They'll send it out to each eligible employee based on what you guys were designing. Then they'll get their notices. So they have 90 days before the plan start date in order to enroll. They can shop on the marketplace. They can shop on their own. I highly recommend shopping directly with carrier. The reason being is a lot of your plans on the exchange are silver loaded. So you're seeing plans with higher costs or higher deductibles or co-share or co-insurances that are specific because of the tax credit. A lot of carriers have direct plans that are not silver loaded. Specifically, we have a 5,000 that you will never see on the exchange, Silver 5,000. It was specifically designed for ICHRAs. And it's more cost effective than any silver plan you'll see on the exchange. Okay, so always shop directly through the carrier. You can shop through the marketplace, but always shop through the carrier too. Once you're what?
It's a lot of work comparing all these individual carriers rather than seeing them all at once. I mean,
Yeah, it is a lot of work. It is a lot of work, but it's also asking the questions. So
for sure.
networks. We know for a fact that Blue Cross has Kootenai Health. I mean, there was a concern of us not having Kootenai Health, but we know for a fact that Blue Cross has Kootenai Health. So now we can say, okay, what carriers don't have Kootenai Health and network? We can eliminate those carriers. And then that's going to break down how quickly you're going to have to search on the direct exchange or direct plans. Yeah.
The downside to that is if they leave an employer, maybe that chance to pay.
That would be the downside, yes.
But if you lose the ICHRA, does that give you a SUP to go on the exchange?
You lose the funds that are being applied to it, but the policy still remains the same. Now, some exchanges, and I have not checked YHI, but I will tell you that Washington Health Plan Finder will allow for a member to come from a direct policy to an exchange policy.
If you get a spread.
Yeah, if they qualify for a direct spread. So, and you'd have to confirm with YHI because that one I've not been on their meetings. I've been on Wobbies.
So since you're not really
Well, I tell
in the
people that
Idaho area, are these like trending here in Idaho? Or is it more of a trend over in Washington?
Surprisingly enough, yes, in southern Idaho. They are starting to grow up here, but they are very popular in southern Idaho, mostly in Ada County. So, yeah.
So how does the ICHRA work if you have an employee who's turning 65?
They can continue to maintain their ICHRA and apply it towards their Med Advantage and or Medicare supplement plans.
So how does that, do they reimburse them the money for the premium of the
It would be a
supplement plan?
different classification.
Yeah, it would they would qualify as a completely new classification. So they get a new initial offer letter, which allows them to terminate their ACA plan and enroll into their Medicare plan. And the third party administrator at that time is going to set up the payments to go directly to the carrier.
Can they pay Part B with it?
Yeah. So whatever, if they're offered $1,000, okay, and their premiums are only $500, they still have that other $500 that can be used to any Medicare eligible, or I'm sorry, medical qualified expense by the IRS, which
So
includes
their
parking.
deductibles.
Yeah,
Is,
so-
is that
Drug plan.
is that the same for under 65?
Yes.
So if I have a policy 300 and I get 500, I have $200 to put towards. Okay. The other question I have, if I get ICHRA and I use all my money towards premium, can I still, and I'm on the bronze plan,
Mhm.
the ACA, can I put money towards an HSA still?
Yes.
Because it's two different accounts.
Yes. And your HSA plan, because of the new IRS ruling, that's mostly on you now at this point. So your employer is not contributing to the HRA and the HSA.
No. Yeah.
They're only contributing to the HRA.
Yeah.
Yeah. So you can have both.
So you can open that up yourself.
Yeah.
Yeah.
And I had to understand a lot of the different HSAs that are out there. So in Idaho, our version of an HSA is an MSA, and that's if you were purchasing that directly through a bank. So a lot of members will go to their bank and say, "I want an HSA," and they're like, "We don't have one." No, they need an MSA. Same thing, but it's the personal. HSA is employer based Idaho, which is weird.
So if, and I actually have a question about the Idaho MSA. Does that stay in Idaho? Or
Yes.
is that money that you can, if you move, where does that money?
You can transfer it to another HSA account,
Okay.
but yeah, it's an Idaho based account.
Because it has different limits, right?
Yeah. Yes.
On the design the plan,
Mm-hmm.
choosing a plan year start date, you said it follows ACA timelines.
Yes.
So when would they be able to choose their plans? Like, let's say you're talking to a group that wants to start July 1st. Would they be able to choose their plan every year for July 1st?
Yes and no. So they have a short year and then they have a long year. So their first initial plan year is going to start July 1st, but it's going to end December 31st.
Okay.
And then their plan starts January 1st to December 31st. So I know we've done a lot of that in the Aflac world. When I did that, we would have a short plan year and then a long plan year. That gives them the initial offering to say, "Hey, I want to experiment with this. I want to give this a test and see how it's going to work. We'll give it 6 months." But then they go from January 1 to December 31st.
Do they have to, so if it starts July 1, they have to enroll July 1, or do they still have the 60 days?
So in that case, yeah, it would have to start they would have to say, give the initial offering letter prior to July 1st.
Okay.
Their plan would start July 1st and carry through until December 31st.
So you have to enroll on that Sunday.
Yeah. Yeah, there's. I know. All right, we're not to answer that. Except now we're getting to the Q&A one. So I actually had a few questions that came up that I'll go ahead and read through here. Mostly because where'd you go? Whoa. I don't know what I did. But that's okay. It's English. Me? Technology? No, never. My grandmother can read this right now. Holy crap. I just want to get to my questions. Okay, there we go. All right, now I can scroll down here. Okay, so in going through all these questions, first question, I guess, is how many businesses did you think of off the top of your head that you're working with now that this might be a fit? Maybe one? Okay, that's good. Mostly I want you to understand this because it's going to be a tool in your tool belt because we're going to start seeing things. One thing I do want to pull up after I go through some of these questions is IDEON, and I'll send you this link as well because IDEON keeps a tab on where ICHRAs are at, when it's going to be beneficial as far as rating and adjustment, and they take every carrier's information and put it in one place. So you're not seeing our rates versus Blue Cross Blue versus Pacific Source. You're seeing the average of all of the carriers in that rate when it's group versus individual ACA. And you can manage it between the silver, the bronze, the gold.
How do you spell it?
IDEON.
IDEO.
IDEO. EON.
EON.
IEON. Yeah. And I'll send you guys the link. That's not a big deal. So you had asked the question about the TPAs. And that was one of the questions that came in with me. So $5 to $15 is what we have as far as an average. And sometimes there's a percentage fee of 3 to 8% of total reimbursements. So if there's commissions applied, they usually will apply the additional 3 to 8%, depending on the size of the group. I think we actually answered all of these. What happens if an employer loses an individual coverage mid-year? Can't afford. Yeah, never mind. We've got them. So anybody else have any other questions? Yes.
I have some guidance about interesting, like, the root of for eligible. They were explaining that some of them
Oh, COBRA eligibility.
address that.
Okay, yeah. So with COBRA eligibility, there's if your employee chooses to accept their COBRA and midway through their COBRA decides that they want to go on to the ICHRA, they cannot. They have to wait until their COBRA is fully exhausted before they are eligible for their ICHRA.
For that other classification of
Former employee.
Former employee.
former.
Yeah.
Why would an employer do it?
It's not the employer. It's the IRS rules as far as because if
So
the
why do they-
and the catch is to this, when it comes to COBRA, you have two different types of COBRA. You have COBRA that is being funded by the employer, and then you have COBRA that is not being funded by the employer. The COBRA that is not being funded by the employer can be terminated, or you can choose not to accept it and move on to an ICHRA, and you're fine. But if you have one that is being funded by the employer, you have to exhaust all 18 months before you can decline it.
So that
Does
means
the employer have to have all of those even vetting classifications, or they can just choose to say, I am only funding these classifications and not including a prior employee?
Yes. They can choose, they can limit, that's part of your plan design. Make sure that you've worked through and say, okay, I don't want anybody that is eligible for this.
Somebody I just fired for a cause.
Yeah. Exactly. That's
so
a good
think about your current employees, but also the people that leave.
Yes.
Or need to be.
Yes. There was a thought that came to my head when I got to that. Okay, so and the other thing you need to know is when you're doing with an ICHRA and implementation, it will take 3 to 6 months to get it ready. It's not as quick as
Setting up your
Jackie.
So,
Yes, that's why it's a 3 to 6 month process.
Three.
But believe it or not, there's a lot of employers that are going this direction, which is crazy. So one of the biggest mistakes that come up with ICHRAs, I did it again, come back here, thank you. They are one of the questions that came up was what are the biggest mistakes employers make with ICHRAs? So there's 3 of them. Inadequate employee communication and education. If they're going to do an ICHRA, make sure that there is constant communication. There is adequate education on it. A lot of the applications that we have seen come through where we've called to assess with members, they're like, I don't even understand what an ICHRA is. And we're like, okay, let's have a conversation. So they just need to understand the whole picture. The second would be setting allowances too low. So have the conversations with the employers that like, yeah, I realize that budgeting is what you're looking for, but at the same time, do you want the complaints as far as these costs go? So we need to look at, is the ACA option available with the ICHRA more cost effective? Or is it more cost effective to stay on this traditional group and have those conversations? And then third, finding that TPA. Make sure your TPA knows ICHRAs. There are 157 of them out there. I work with 37 of them. We are being very particular about who we do bring on at Regents as far as TPAs. I'm sure you guys are as well, because there are a lot out there that are just platforms and not actual administrators. And then you have some that are out there that are administrators that don't have platforms. So be very particular about the TPA that you're working with. Do the research, check to make sure that it's going to fit the company that's going to work for you. Yeah.
So what is your percentage of really placing us at this point, even if it is just over in Washington or if you have numbers that are down in Ada County that really wish that push that, I mean, I know that we're all kind of moving in a market. But what do you think that big push is? I mean, our employers are really open to those alternative options now. And I mean, it's gonna be, I mean, if you're saying it's gonna be 3 to 6 months before you can really get that implemented, I mean, your homework is gonna be, I'm really wanting and networking and,
Yeah.
meeting this employer ongoing in order to have them understand and educate that. I mean, if it's a 6 month thing, it's like, I'm gonna know this person pretty well.
Yeah. Sue, oh, I need to connect to the internet. That would be helpful. The group insurance. I'm not exactly sure how to answer that one. It's
I mean, what's the downfall, downfall of the group, the renewals and just the way the market is going, but it's like health insurance and healthcare, all of those numbers are kind of connecting anyway, so what's the issue, the real advantage of it?
well, and that's okay. So this is a better way of putting it. Our current administration has been implementing and has been pushing to implement more options to direct employers towards ICHRAs. So you're going to start seeing a lot more tax benefits that are coming up. You're also going to see that based on states, they're implementing more tax benefits state locally. So employers are kind of looking a lot more towards, okay, how do I save that money? But also, where else can I save the money? And is the cost of the tax saving here worth having the TPA and me washing my hands of a traditional group plan? So a lot of that is kind of what comes into play. One thing I noticed, so number wise, last 2025, we had over 15,000 ICHRA applications come through regions. 2020 individuals, yes, individual ICHRA applications. That was between Oregon, Washington, Idaho, and Utah. Okay, next year I'm not even going to know because we have North Dakota. This year, this open enrollment, we had over 25,000, and 90% of that was between Washington and Oregon. We had probably about 10% in Utah, but 5% in Idaho, which shocked us because at the time the numbers didn't make sense in Idaho, but Ada County, it shot up.
Well, I think it's kind of nice to be able to have this alternative option because there are people that we know that the employer is not offering anything.
Yeah.
And yet the employee says, well, I don't have any insurance. And it's like, so
It's a great alternative for
people
small.
do know that there's the marketplace, but they don't want to be bothered with the process of giving up their life story and how much they make and qualifying. But I think if it's presented at a group level that you have that access to the employee and can have a conversation about individual.
Yeah, that's my receipt. So I made a mistake. What did I do? Okay.
You should push the wrong button.
I did. Come on. It's you.
Well, I do know that it does take, the employee doing their part too. You have to submit I do this every month. I submit it. I have an app. It's great. But what if the employee doesn't do that and they don't submit? Can they be kicked off of the ICHRA if they're not submitting their receipts and they're getting reimbursed? Like they won't get reimbursed at all? How does that?
So they don't get reimbursed.
Okay.
It's a use it or lose it. So if they don't submit it
for that month, it's done, but they can stay on the
Yes.
ICHRA. Okay. I was just
The
curious.
employer gets to keep that.
Yes.
I can just, it gives me an automatic text and I say, yes, I don't have to submit anything. So it's really nice.
Okay, so let me put myself here on
Sorry.
something. There we go.
It's my work.
Okay.
Say why.
So this is IDEON, and this shows you the entire US. Obviously, I'll come up here. Everything that is green is that is not what I wanted you to do. Everything is green is where they are calculating. Really? I love technology.
No, it's just that
Now, actually, I do wish I had an apple. I was very good with my apple. Okay, so this is based on a 27-year-old male bronze level in your county. So Washington State, you can see, is all green. Oregon is purple. These counties right here in Idaho are green, and Utah is purple. So what it's saying there is that the cost of a plan for individual is cheaper than a cost for a group plan for a 27-year-old. And that county is $101 difference between an individual rate and a small group rate. It's kind of one of those fun little things to play with.
So what's the black? Is that dark green or is that black?
Oh, that is very dark green. $455 rate in Champaign County, Ohio is the difference between $308 for an individual or $764 for a small group policy. Yeah. Some states it makes sense. Some states not so much. But IDEON is a very good little kind of assessment. I'm going to change this to 50-year-old male because this one is really where it gives you a difference. So in Idaho County, there's only an $18 difference between a small group and large or small group and individual. Same with Latah County. There's a $2 difference in, I'm not even going to try and pronounce that. Oahe, thank you.
Those rates on similar plans, though?
Yes. So what they're looking at is they are taking an average of all group plans and an average of all individual ACA plans. So it's not,
silver, gold.
yeah.
So where does it show up in the panhandle?
Panhandle, it's actually, it's a $35 difference. The group plans are $35 cheaper than the ACA plans. Yeah, for a 50-year-old. But like in King County, it's 190 or Calamity. Yeah, thank you. It's $193 difference. So it's cheaper to go onto an individual plan than it is a small group. But remember, individual plans in Washington are EPOs. They are not PPOs. So is it worth that $193 difference? But this is a cool little site that kind of gives you an idea. They update it every year. So bookmark it, keep an eye on it. It will definitely come in handy.